All right, we originally posted this video a couple of days ago, but found some areas where I did not clarify, or I should say our trusty viewers found some areas where I didn't clarify enough as to where these numbers were coming from immediately after we released the video. So we pulled it down, we've corrected those in this video. The total out-of-pocket costs to you are the same for any of you that saw the original video. This one is just much more clear as to how those costs are handled between the plans and original Medicare. We had bundled original Medicare and supplement plans into one, and we're just gonna split those in this video. And it actually illuminated a point that we've made in other videos that we weren't intending to make with this one. So in this video, I'm gonna go over how a high-cost medical situation would work and be covered if you were on original Medicare with a Medicare Supplement Plan G versus a high deductible Plan G versus taking a standard $0 Advantage plan in our area instead of original Medicare. If you appreciate the willingness to admit I made a mistake, maybe that earned a like or a subscribe from you, but I'll let you decide. Now, I'm using a breakdown from a patient's bill that outlines the costs from a surgery that this individual needed. I do round these numbers to the nearest 100 just so that I'm not dealing with odd dollar and cents amounts, because, well, I already admitted to a math issue earlier, so we're gonna try and keep it simple. In this example, we are talking about a Medicare-approved, medically necessary surgery that was covered. This is not made to make a statement of which plan option is better, simply to show how the claims would work and the dollars you could expect to pay in this type of situation based on the plan that you would have. As part of this equation, we are pulling in the annual premium costs just to have these plans, again, to show the full picture into how much money you would need to come up with. This video is strictly looking at dollars and cents. Ease of use, networks, prior authorization requirements are all very important things to consider when deciding between these plans, and those are covered in a bunch of other videos on our channel, including this one right up here, but that is not the topic of this video. This one is taking you through a real-life example of how claims are paid. So in one of our other videos, we go over the average premiums in our 5 surrounding states for each of these plans, and I will list those here on my trusty whiteboard. The average in our area for Plan G is $1,800 per year or $150 per month. High deductible Plan G averages about $670 per year or about $56 per month. And the most common Advantage plans in our area are $0 premium plans. Okay, let's talk about deductibles. These are the dollars that you need to pay first before your plan will start helping at all. These are annual deductibles, so they reset each year, and in the case with supplement plans, typically change each year. Plan G has the Part B deductible of $226 in 2023. The high deductible Plan G has a deductible of $2,700 in 2023. Most Advantage plans do not have a deductible. Now, all of these costs for this bill were Part B expenses. Leading up to surgery, you will likely have multiple visits with a specialist. Twice before and twice after is common, so we need to eventually account for 4 specialist visits. Each visit in this example I have was right around $250 for a total of $500 pre-surgery and $500 post-surgery. Original Medicare covers 80% of the Part B costs, so Original Medicare will cover $400 of the first 2 visits. The remaining $100 gets passed through to the supplement plan. With regular Plan G, you have that $226 deductible that you have to pay first, so you would be responsible for the $100 total bill of the first 2 specialist visits before surgery. With your high deductible G, so far exactly the same as regular G because you have that $2,700 deductible, so that $100 not covered by Original Medicare is your responsibility. With the Advantage plan, I took the 3 most common in our area and took an average. Now, none of them require a referral. Many Advantage plans do. These particular plans do not, and the specialist copay is $30 per visit. Remember that with an Advantage plan, the insurance company is now responsible for all of the costs, not Original Medicare. So those first 2 specialist visits mean that you have $60 in copays that you need to pay, while your plan pays the remaining $440. Next, with a surgery, you will often have some sort of imaging. This one had an MRI. There is a wide range here on the costs of an MRI across the country and what part of the body is being imaged. For this one, we're looking at $1,300. Original Medicare will take care of 80% or $1,040. There is $260 left over with regular Plan G. You still have $126 left in your Part B deductible, so you would pay $126 and your plan will pick up the remaining $134. With high deductible Plan G, you have not met your deductible yet, and you are responsible for $260 left over that original Medicare did not cover. With the Advantage plan, the plans here have an average of a $50 imaging copay, so you would pay $50. The insurance company that took away the risk from original Medicare now pays $1,250. Now we have the actual surgery itself. The one I'm looking at was $23,997, so we're going to round that to $24,000. Original Medicare will take care of 80%, so $19,200, and that leaves $4,800 left over. With regular Plan G, you've met your deductible at this point. You would pay nothing. Your plan would pay all $4,800. Your high deductible Plan G still has a little cost sharing for you. Since you haven't met that deductible yet, you need to pay $2,340 of that $4,800. Now you have met your deductible at that point, and the plan will pay the remaining $2,460. These Advantage plans had an average of a $350 outpatient surgery copay that you would need to pay. The insurance company pays $23,650. Now we address those two specialist visits after surgery where they will check up on your healing and do their follow-up. Like the pre-surgery visits, original Medicare takes care of the $400. Since you've met your Plan G deductible, Plan G takes care of the remaining $100. Same story for high deductible Plan G, and the Advantage plan has those two same $30 copays for $60 that you need to pay, while the plan pays $440. Finally, we're going to include several physical therapy visits post-surgery, each visit costing about $150, and we have the number of visits at 10. Original Medicare will pay $1,200 towards those physical therapy visits, leaving $300 left over. Plan G and high deductible Plan G deductibles are met again at this point, so you are covered and you don't have any out-of-pocket costs, while the plan pays the $300 left over. These Advantage plans average $30 copays per visit. 10 visits is $300 for your out-of-pocket responsibility, while the Advantage plan insurance company pays $1,200. I just need to remind everyone again, Advantage plan copays are all over the place depending on the company and where you live. You may see lower copays than what we're talking about. You may see higher copays than what we have here. All right, let's look at the total costs. Remember, we are including the plan premiums. We are not including Part B premiums, which are also something to be aware of and typically apply equally to all three of these plans. We are not including Part D prescription drug premiums that would typically only apply to the two supplement plans, not the Advantage plan. So all costs combined are $27,800. Let's talk about original Medicare and the supplements first. The total cost to original Medicare in this instance is $22,240 of that bill, leaving $5,560 left over. Regular Plan G takes care of $5,334, and you are responsible for the $226 Part B deductible. And going into your total costs are the premiums to have the plan for a total of $2,026. High deductible Plan G takes care of $2,860, and you are responsible for the $2,700 deductible, plus your premiums to have the plan for a total of $3,370 that you would pay. In the Advantage plan scenario, the total cost for this surgery to original Medicare is $0, and to the Advantage plan is $27,800. Remember, with an Advantage plan, you are no longer on original Medicare, and the company offering the Advantage plan takes on the risk and responsibility of those costs, so that full $27,800. With your copays, you pay $820. You don't have a premium in this case, so your total out-of-pocket costs are $820, and the plan pays $26,980. So, what do you think? Did it turn out how you expected? There are a couple more very interesting points coming up, but I know that a lot of people have a lot of strong opinions on this topic, so feel free to throw a comment about whether this surprised you or not. Speaking of comments, we love seeing your comments, whether they agree with us or they disagree with us, and we understand that people have different opinions than us, and that is totally fine. I personally respond to most of these as well as some of our team members. We try to reply to every comment that comes through that is genuine and real. We remove comments that have inappropriate content and links. We do not respond to comments on conspiracy theories or comments where we don't really understand what's being said. But outside of that, we will interact with you as much as you'd like. Just try to keep it civil. Now, I know what's going to happen here. Half of the country hates Medicare Advantage plans and will claim that I'm pushing Advantage plans because there's no way that an Advantage plan could ever show any sort of benefit to the world. I'm sorry to be the bearer of bad news here, but that is just not correct. First, we do not push Advantage plans. And second, there are situations where they do work and they do make a lot of sense for people. Not everyone, but yes, they do work for some. It will probably rub a lot of people the wrong way to know that these numbers are from actual claims and the claims were paid by an Advantage plan. Now, do they all work this way? No. Can people run into prior authorizations and denials with Advantage plans? Yes. Again, we have lots of videos on this, but this video is meant to show how claims work with each of these plans. Now, here is the point that was illuminated during this second recording because we showed original Medicare's role in all of this. In this situation, not all situations, but in this particular situation, with somebody staying on original Medicare and taking a supplement plan, this whole experience would have cost the Medicare system $22,240 minus this individual's Part B premiums, which are typically $1,978.80 in 2023. And those go back to Medicare, meaning that for this individual, the cost to the Medicare system for this experience is $20,261.20. This same procedure for somebody on an Advantage plan would have cost the Medicare system the amount that Medicare pays to the Advantage plan to take on this risk. We don't have exact dollars on that in this situation, and it's highly variable based on the geographic location, the risk that the plans take on, and the star ratings of those plans, but it is a pretty wide range. And for illustrative purposes, let's just say that it's $1,200 per person per month. That means that Medicare paid out $14,400 in that year for this surgery, minus the same Part B premiums that the beneficiary pays back to Medicare. Again, in this example, it's $1,978.80, bringing the cost to the Medicare system to $12,421.20. That's a 39% lower cost to Medicare for this particular procedure. Now let's take this one step further. Imagine that in this same year, you have a second surgery. This example was not a knee surgery, but pretend that it was, and you need to have the second knee done in the same year with identical costs. With the Supplement Plan G, you've already met your deductibles, and your annual cost to you stays the same at $2,026. Same with High Deductible G. You've met your deductible, your costs stay the same. With the Advantage plan, assuming you haven't hit the out-of-pocket maximum yet, your cost doubles to $1,640. So as you can see here, if you have a year with multiple surgeries, multiple imaging tests, multiple doctor visits, those copays can add up. Two of the higher cost copays and coinsurance amounts on Advantage plans are inpatient hospital stays and cancer coinsurance. These both can contribute to higher costs to your Advantage plan up to the out-of-pocket maximum on that plan. We have a video on that particular topic right here. Out-of-pocket maximums are all over the place as well, depending on where you live and the company that you choose. I've seen as low as $500 for out-of-pocket maximums and as high as $8,300. The average in our area is $5,500. That's average. We have some higher and some lower. Strictly from a dollars perspective, if you do not use the healthcare system a lot, Advantage plans will cost you less than supplement plans, which in turn will cost the Medicare system more relative to supplement plans. If you do need to use the healthcare system a lot, there will eventually be a break-even point based on your plan and the copays to where a supplement plan will be more cost-effective for you than an Advantage plan. But this will contribute to higher costs for Medicare compared to an Advantage plan, which could cost you more but save Medicare money. Isn't it wild how convoluted this can get? Let's go back to the cost to Medicare real quick on the second surgery because it becomes an even bigger difference. The cost to Medicare on the second surgery more than doubles over the first surgery with the supplement beneficiary to $42,501.20. This is because we built in that Part B premium to the first surgery costs. We don't get to double that Part B premium the second time around. And the cost to Medicare for the Advantage plan beneficiary after the second surgery stays the same at $12,421.20, an even bigger savings to original Medicare. Now, these dollar amount costs to Medicare really don't have anything to do with your decision between an Advantage plan and a supplement plan. We've never had anyone say, you know what, I would like to save the Medicare system money, so I will choose this plan. Please don't make your decisions that way. Your decision comes down to which plan will benefit you the most. I point this out just so that when you see the headlines around Advantage plans receiving dollars to take on the risk of original Medicare, you'll understand, number one, why the Advantage plans will try to manage risk through copays, coinsurance, prior authorizations, denials, and networks. Number two, how that could impact your experience on that plan. and 3, why the government has a vested interest in making sure all of this works well and the plans are not denying necessary services. We have these videos right here where you can learn more about how each of these plans work outside of just dollars and cents, because as we've stated, there's a lot more that goes into this decision between these plan types that involves networks and managed care and a lot of other factors that many people find important. Some don't. For some, all that matters are strictly dollars and cents, but we'd recommend looking into the full picture of these plans before making a decision. All right, finally, we always recommend working with an agent when making these decisions. Agents never cost you anything to use, and they never will. If you have an agent in your life who you trust, please use them. Even if it's not us and it's our competitors, please use an agent. Make sure that they offer both supplement plans and advantage plans. If they only offer one, that is usually, not always, but usually a red flag. Make sure that they represent several different insurance companies and not just one. If you'd like help looking into what plans may make sense for you in your area, we're always happy to help in any way that we can. If we're not licensed in your state, we have partners all over the country who we trust, and we can introduce you to them for assistance. Hey, that's all I got for this one. I sincerely appreciate you taking the time to watch this. We'll see you in the next video.